All right, well, it is noon, so we will be respectful of everybody's time and get going. So first and foremost, I'd like to welcome you to today's webinar. We will be speaking about lifestyle health, and we have the pleasure of speaking with Dr. Misti Zablosky. She's the Interim Chair of the Department of Lifestyle Health Sciences. She's also an assistant professor as well as a program manager. So I'm really excited to get to talk to her, but before we jump in on the content today, I do have some housekeeping things. So we've been doing these webinars for months, but I'm happy to see that a lot of you are new here. So first and foremost, welcome. My name's Katie Heesh. I work here at the Health Science Center at Fort Worth. These sessions are recorded. We want them to live on forever. So just make sure your video's off, you are muted. If you do have a question, comment, or concern, please use that chat function in Zoom. We will look at them at the end and address all of the questions throughout. As well as it being recorded, we will post it. It'll be sent out so you can come back to it. Don't feel like you have to take quick notes. You can always watch it later. Today is a melting pot of people. We have prospective students, we have current students, we have staff, faculty, community members who are just interested. So we're happy to see all of you. With that being said, we would love for you to change your Zoom name to your legitimate name so we know who you are if we need to address you during the webinar. Regarding a question, a comment, or maybe if we want to reach out to you later. So I just wanted to put that out there. So let's jump in. I'm excited to get to today's topic. So Dr. Misti Zablosky, thank you so much for being here. If you don't mind, I'd love to start and learn about you and how you ended up as part of the HSC family.
Sure. So I originally went to school to be an athletic trainer. I really liked working with athletes and helping to treat those athletic injuries. I absolutely loved working with younger kids and even spent a period of time working as an athletic trainer at Children's Medical Center. But I reached a point in that career where I realized that every day working till midnight and working on the weekends would make it very hard to have a family. And so I went back to school and I got a PhD. And after I had graduated, I was hired by a small HBCU in Dallas called Paul Quinn College. And they hired me to develop their first bachelor's degree in health and wellness. So that was really fun. But while I was there, I participated in a research study. We had a partnership with the Diabetes Health and Wellness Institute of Dallas. And the specific study investigated the effects of lifestyle changes in their participants' health, specifically related to diabetes. And I became very interested in listening to them talk about the lifestyle changes that they made and how it really impacted and improved their health. And so in the beginning of 2019, I saw the HSC was hiring faculty to help develop a lifestyle health sciences program and to teach this new degree. And so I applied and here I am. So we currently are teaching our first cohort of students. They should graduate this May of 2021, but they started in June. And so we're just kind of right in the middle of that first group of students.
That's awesome. Well, we're so happy to have you here at the HSC. We love what y'all are doing and we're excited about it. So let's talk about lifestyle health a little bit more. It seems like a newer topic of like an area of study. So what is lifestyle health?
I know we get this question a lot, but just in general, a healthy lifestyle is really just a way of living that lowers the risk of being seriously ill or dying early. And although we know that many diseases are not fully preventable, chronic diseases that are related to someone's lifestyle habits are preventable. Lifestyle medicine is a branch of that, which really is the prescription of lifestyle similar to medication that involves using evidence-based lifestyle similar to eating like predominantly whole food, eating a plant-based diet, participating in regular physical activity, getting enough sleep, managing stress, all of those things to treat, reverse, and prevent lifestyle-related chronic disease.
Well, that seems timely. So, you know, we're in a pandemic. So how is that related to COVID? Has that changed the discipline of lifestyle health at all?
Sure, I would definitely. I think there's a few things that we can talk about really why it's important, even adding COVID in. But really what we know is there's a large body of scientific evidence that supports a strong relationship between lifestyle habits and a person's health. It's estimated that somewhere between 70 to 80% of chronic disease conditions like type 2 diabetes, coronary heart disease, and hypertension are all related to a person's lifestyle habits. And so chronic disease and conditions are the most common and they're the most costly of all conditions or all health conditions as well. Because of this, we're spending 75% of our healthcare dollars towards treating these lifestyle related conditions. A lot of money is going into this. this model of care is not sustainable for any period of time, really. But because of this and due to this, there's a growing demand for providers who can cost effectively address these lifestyle behaviors to promote that sustainable change that will provide them optimal health and well-being. So that's really why we were built. We were established to fill this gap and bring together an interprofessional team of people who have developed curriculum that focuses on merging that evidence-based lifestyle medicine with some competencies from the National Board of Health and Wellness Coaching. But as you mentioned, COVID is obviously the largest current event, and lifestyle medicine can really be involved in creating prevention and treatment strategies for COVID-19. So chronic diseases related to a person's lifestyle are the same comorbidities that are associated with COVID-19 deaths. For example, a leading metabolic risk factor for COVID-19, among many others, is hypertension. There's one lifestyle medicine evidence-based approach that treats hypertension through a nutritional program called DASH. So DASH is this eating pattern, as I mentioned before, that plant-based whole food diet, lots of fruits and vegetables. This specific evidence-based approach has been shown to reduce blood pressure. The reduction of blood pressure, in fact, is similar to that found with many medications that are currently used to treat blood pressure. Another leading risk factor for COVID-19 is diabetes. So there's a randomized controlled trial that is called the Diabetes Prevention Program. It's pretty large, but what this program did is combined a similar nutrition plan as DASH, that whole food plant-based, with 150 minutes of weekly physical activity. So that was a new addition for this study, as well as lifestyle health coaches, which is similar to what we do. This study found that this unique combination of the food, the exercise, and the coaches helped to reduce type 2 diabetes by 58% compared to a usual care protocol. So I could go on and on with the research, but what this is really telling us is that lifestyle changes can prevent, treat, and reverse chronic conditions. And most of these treatments and preventions or reversals all are achieved within months, if not in weeks. Since lifestyle medicine can have this effect on chronic disease, then lifestyle medicine can also reduce the risk of dying from COVID-19 by preventing and treating these comorbidities. So obviously there's a lack of firm evidence with many things COVID related, and the effects of lifestyle is very similar. However, there is really low risk involved in lifestyle interventions. And given this previous research and all the correlations, there's some strong potential in this area. Also, something else that's happening is obviously provider burnout, right? The state of the healthcare system in COVID, we have providers who are burning out exponentially. And so lifestyle medicine and emotional well-being approaches are key to treating and preserving the physical and mental health of individuals in the healthcare profession so they can continue to fight this battle. Another thing that we're seeing with COVID-19 is that employers and employees are changing the way that they see wellness. More employees are focused on improving their lifestyle, preventing chronic disease. So employers will need to start responding by providing wellness plans that are far more comprehensive than they most currently provide to their employees. We've already started to notice this trend with more companies hiring health and wellness coaches within their wellness plans. And because this pandemic isn't expected to end anytime soon, it will continue to correspond with anxiety, depression, and substance abuse. So we'll need to follow and use science, evidence-based practices that can promote positive mental health and well-being as related to lifestyle medicine. So our program addresses all of these issues. Students will learn those therapeutic, evidence-based lifestyle and coaching approaches that will help them improve their health and well-being and the health and well-being of others in every area. And since our program's application focused, they'll have an opportunity to practice that many times throughout their time before they graduate from us.
That's great. And I think you made a really good point there that employers are paying more attention and hiring those coaches, because I think too, just as a general public, we've paid more attention to, the underlying conditions and things that were not really top of mind. So now that we are in the pandemic and it affects our everyday life, we are thinking more about that. So, lifestyle health coaches are, I'm sure, in desperate need right now. You're probably busy.
It's changed a lot since the beginning of our program. We'll talk about that a little later, but it's changed dramatically since the beginning of the program for sure.
Oh, I would imagine, especially in 2020. I think everything's changed.
Mm-hmm. Everything's changing.
So you were addressing what the students will learn throughout your program. Can we talk about the curriculum a little bit more in depth? So what specifically, maybe what courses, what opportunities will they have? to address some of these, the changes that are going on now because of COVID?
Yeah, sure. So our curriculum is pretty unique. We're the first graduate degree in the nation that combines lifestyle medicine with health and wellness coaching. And we haven't talked really about health and wellness coaching, but these coaches are expert facilitators of mindset and behavior change. They help generate healthy lifestyles, which prevent and treat disease and obviously foster well-being and thriving. So within our program, we have kind of a melting pot, a variety of courses. They'll take evidence-based medicine, exercise and nutrition for health and chronic disease. They'll go through a course called health literacy and communication, psychology, behavior change, health through the life cycle. They'll also go through a course that is addressing healthy behaviors, wellness program planning. In addition to all of that, we also have 5 application-focused mosaic courses. Within each course, there's a focus on a kind of a unique topic. So you'll see things like cultural conversations, which is very timely, culinary coaching in the nutrition course, patient safety, emotional intelligence, nonviolent communication, exercise medicine. So we have just this unique topic of focus that the course is built from.
That's great. And I think people should get excited about this because I keep hearing you say the word unique and innovation. And I feel like at the root of the HSC, like that's the heart of our institution. So this seems like very unique to the HSC and a great opportunity for everybody. But let's talk about existing students. So maybe somebody else who has previous HSC training. How could this program be complementary to that?
Sure. So health providers are at the center of the healthcare model, and without providers participating in assessing and prescribing lifestyle as medicine, the healthcare system won't be sustainable. So as I mentioned before, there's a growing demand for providers who can cost effectively address lifestyle behaviors. One gap that has been identified is really a lack of training in this area of prescribing lifestyle as medicine. In 2014, just 27% of medical schools indicated they provided the 25 hours of recommended nutrition education, and only 6 provided a core course in exercise prescription. So our program helps kind of bridge that gap. Medical education and lifestyle medicine is necessary to allow providers to learn how to effectively and efficiently prescribe lifestyle as medicine. And although it's essential that physicians take a leading role in this effort, it's important that other professionals within the healthcare industry are prepared to work as a team, an interprofessional team, to help prescribe lifestyle as medicine. So nurses, physician assistants, dentists, therapists, physical therapists, exercise specialists, even community health workers, we're seeing take an interest in this kind of area. They all need to work as a team along with other allied health professionals to effectively change unhealthy behaviors.
That makes so much sense. And what's the old saying? Everybody just says, oh, well, eat right and exercise. And it's like, right, but how do you do that? So,
exactly.
The lifestyle health coaching, it's going to be so helpful from here going on. So let's talk about the benefits that this program could have on somebody. So what are the patient care benefits or outcome improvements from lifestyle medicine and the health and wellness coach approach?
Sure. So in regard to health and wellness coaching, there aren't any studies that have shown an adverse effect of health and wellness coaching. It's all positive. Studies in which most are randomized controlled trials have shown that the main physiological outcomes of the health and wellness coaching interventions are things like reduction in body weight and BMI, reduction in blood pressure and LDL cholesterol. If you look specifically in the area of diabetes, you'll find that health and wellness coaching interventions provide A1C improvements. Specifically at cardiac risk factors, you'll see a reduction in LDL levels, cholesterol levels, blood pressure, weight, and waist circumference. So many things in terms in that area. But as far as psychological outcomes, the studies show an improved mental well-being that includes anxiety levels, lowering anxiety levels and stress levels, as well as mood, increasing self-regulation skills, and improving readiness to change, which are really important in making these healthy changes. For lifestyle medicine, there are definitely a few patient benefits and outcomes. First, we know that lifestyle medicine reduces the reliance on medication. There's a study of Asian youth that had newly diagnosed type 2 diabetes, and they found that intensive lifestyle therapies alone, and sometimes in combination with metformin, achieved a reversal or even sometimes a partial remission of diabetes within 3 months. So I said weeks to months, so this was months. And this was actually even maintained at a 2-year follow-up. So lifestyle medicine is also sometimes more effective than medication. So studies like the diabetes prevention program I mentioned have shown that lifestyle interventions, and this often includes low calorie, low fat, physical activity, it changes, but those are often the core components, as you even mentioned. could be better than, or often better than metformin at preventing diabetes in patients that had impaired glucose tolerance. Additionally, just exercise alone. So taking out nutrition, but exercise alone in one study was associated with a higher event-free survival, and that means death by cardiac cause, stroke, acute myocardial infarction. That was associated with a higher event-free survival as compared to just a stent alone. So exercise, I love this study because exercise is my background, but exercise had a 26% greater event-free survival than a stent alone. Lifestyle medicine also offers a safer control of some biological markers than other medications. There's a study that uses something called the Jenkins portfolio diet, which was low-fat dairy, whole grains, lots of fruits and vegetables, always fruits and vegetables. This offered equivalent cholesterol control of some statin medications. And then lastly, which I think goes to the sustainability part, is that lifestyle medicine lowers healthcare costs. There is a huge study called the CHIP Lifestyle Program. So this includes lifestyle health education, plant-based diet again, physical activity again, you're seeing that correlation here, but found employee participants were able to reduce their medical service costs by 43%. So just doing those three things, 43%, and medication usage costs by 14%. The other cool part of this is that employers who invested in this program saw a return of their investment after 6 months. So lots of great improvements when it's implemented the way it should be.
That's amazing. I mean, I would love to save money on healthcare, you know what I mean?
we all would.
Oh, sorry. I was going to say, I do want to go off book for a second. You're talking about, it could be weeks to months for these healthy habits and these routines to become just that, a routine. So for somebody who wanted to make these lifestyle changes, maybe without a lifestyle health coach, what's your advice for sticking out those first couple of weeks or months to change that healthy behavior?
I think it changes for everyone, right? And so it would depend on what area you're looking at, but really at the bottom of it is just starting those changes, making that change. And so just implementing a little physical activity, if that means that you get out of your chair every 5 minutes and stand, that's better than sitting the entire day. If it's working towards a predominantly plant-based diet, we say plant-based and a lot of people start giving us those weird eyes, right? You want me to eat all plants. Well, I'd like you to eat more plants than other things. And so just working on incorporating some of that into their diet, I think just making those little changes and then continuing to progress with those changes until you get to meet the goals that you're looking for is very important.
That's great advice. Thank you for sharing that.
Yeah, for
So
sure.
I want to talk a little bit more about the program itself here at the HSC and our community. So again, at the root of the HSC, I think being involved and being an innovation and, a provider to our community is at top of mind. And especially President Williams has said it again, it's about the community. So in what ways will the students who are doing this program impact our community in Fort Worth or at the HSC directly?
Sure. So HSC's purpose is to transform lives in order to improve the lives of others, and we're doing exactly that. Not only are our students' lives transformed as they become more educated in this field and maybe make healthy changes themselves, pass this information on to their family and friends, help their family and friends become more healthy, but they will go on to work in jobs that will directly improve the lives of others. So it's super important. The mission of the HSC is to create solutions for a healthier community. So we look outside the box here. We know that we can't help to improve the overwhelmed healthcare system, increase the shortage of key providers, reduce healthcare costs, or increase productivity without having an innovative mindset. Our program was spawned by thought leaders and forward thinkers at the HSC to determine what additional educational program could graduate students who would provide these solutions for a healthier community. And we're encouraged here and supported here through innovation that's really required to create a curriculum and implement a degree like this one.
That's great. And I would love to hear more about the degree. So why was this program developed? And it just seems like a passion project, truthfully, but what was the reasoning behind it?
Yeah, so, there's a few things. So the program was developed for the same reasons I mentioned when discussing the importance of lifestyle medicine. We know lifestyle habits are important to a person's health. We know that the current healthcare system is spending an enormous amount of money treating these lifestyle-related diseases. We know the medical schools don't always offer an extensive amount of education in this area. We know that health and wellness coaches can help walk alongside these people as they move to making lifestyle behavior changes. We see the benefit in a provider who has education in both lifestyle medicine and health and wellness coaching. And I think we really wanted to be part of the change in helping train these people to be leaders in in healthcare reform, really.
That's great. And again, goes back to the root of the HSC, that innovation, helping others. It's great to hear. So I want to speak to the prospective students or maybe current students who are thinking, well, this sounds interesting. So who should apply for this program?
Yeah, so the admission requirements require a bachelor's degree and preferably a health-related field with a 3.0 GPA. We suggest that applicants have some coursework in like a foundations course, nutrition, psychology, anatomy, and physiology. These aren't prerequisites, they're just encouraged courses to help them be successful within the program. We're looking for people who want to influence the future of health and wellness and support the health and well-being of others. We're looking for students who want to be change makers in the future of healthcare delivery, who are passionate about helping others, who maybe are looking to advance their credentials in the field of health and wellness, who want to change lives, create a healthier future, maybe build their marketable skills while also becoming a certified health and wellness coach, but just those who can imagine with us a better and healthier future.
That sounds great. I'm inspired. So the students that you currently have that started, I believe you said in June.
Yes.
Why are they saying that they chose this program? What's their reasoning?
Sure. So some of our students want a career in corporate wellness and they're passionate about helping others achieve a healthy lifestyle. Others want to gain knowledge to be better support for their current patients in whatever field they're in. We have some who want to pursue a career in medicine and felt that this degree would help supplement their training. And in fact, that student who made that comment just got accepted into medical school. So we're excited about that. So he'll finish our program and then go on to medical school. Our students want to learn how to enact lasting change. They want to have an integral role in doing that. They don't want to sit out on the outside. They want to be part of that change. And they also believe that integrating all of these health, psychology, behavioral health, physiology, emotional intelligence will help develop their ability to lead others in whatever field they're in.
Awesome. And congratulations to the student of yours who just got into medical school. I have 15. That's amazing, truthfully.
We're so excited. Yes, we're definitely excited for him. So we threw a little virtual party when it happened.
That's great. A 2020 party.
Yep, there you go.
So I heard you mention corporate wellness. Obviously, we're talking medicine, but what other career fields can these students go into after they graduate?
Sure. So we've seen a huge growth in this area since starting the program, especially now that telemedicine has become important. We're seeing companies who are adding health coaching into their WELL programs and some of their even digital applications. So digital tech companies like Livonga Health, Vita Health are hiring health and wellness coaches. In the local area, companies like BNSF Railroad, Lockheed, DFW Airport offer health and wellness coaches within their corporate wellness programs. Wow. PCPs are hiring health and wellness coaches to be part of that interprofessional team like I discussed. Health hubs like Walmart and CVS and Whole Foods and Amazon are hiring health and wellness coaches. Addiction treatment centers. We have actually a very large number of HR students in our program right now who are super interested in learning how to help their employees come back from their extended leave earlier and help in a healthy way, obviously. So that's really was shocking to us, but we think it's a great avenue for students to go into. Health insurance companies, employee assistance programs, other health professions like PAs, PTs, DOs, athletic trainers, personal trainers, and then those who wish to work with the underserved populations in the community.
That's great. So it's just a wide variety. And I think it does go back to the interdisciplinary teams that you're talking about. I mean, it just makes sense to have this background in lifestyle health, and you can use it in every job or career field that you're in. Like you're saying, HR, that makes sense. And obviously like a doctor, that makes sense. So
and at first we struggled with really trying to tell our story to people because it was so broad, but now that the world is changing and things are falling into place, it's easier for us to still tell our story, but do it in this way. And so because it is so broad, I think that really shows the value in the program.
It definitely does. And it just makes sense. Mm-hmm. So let's talk about the future of the program. I mean, there's nowhere to go but up. So what does the future look like to you? What's the future of maybe lifestyle health as a whole?
Yeah, so just for our program, we're obviously super excited to graduate our first cohort Currently, our application portal is open and we're accepting applications for the next cohort, which would start in June of 21. We're looking to increase our cohort size, continuing to involve field experts. I didn't really get to mention, but we have some generous donors who have helped us to incorporate field experts. Like we're about to have Dr. Kenneth Cooper from Kent Cooper Aerobic Center speak at one of our mosaics. So we've been blessed in that way. We're looking to create micro-credentials and possibly modular electives for students like in pharmacy and TCOM. But the future of lifestyle health as a whole, I think is interesting. In the past, the future of healthcare, we really looked for like new diagnostic procedures and therapies, drugs and medical devices. And all of this was very impressive, but mostly were kind of incremental in nature. So going forward, the emphasis I think will be placed on healthcare that includes prevention, is more personalized and is more tailored to a patient specific like genetic profile and their needs. Lifestyle medicine and health and wellness coaching will be an integral part of this model because many of the tailored treatments would be lifestyle interventions. So we see that as a future for lifestyle medicine. Additionally, it's really only a matter of time before efficient care models will be everywhere. And so models that are 24/7 access, proactive, patient-centric, those that can be remotely managed, very similar to how health and wellness coaches are already currently functioning with their clients. The other interesting thing I think we'll see is a growth in technology that can connect a patient to their provider. And so I'm talking about like people wearing sensors that will collect information about their health condition, their activity, their behaviors, and their environment. And so all this information will be collected and then obviously safely made available to the provider. But the cool part about this is that the availability of this data makes care more proactive, and it gives providers an opportunity to say, hey, this is a concern, let's address it before it becomes a threat. At this point, that interprofessional team of clinical support, like health and wellness coaches, would then help manage the issue before it got to a point of requiring the knowledge or in care of a provider. So that would, I think, is also a very key play in for lifestyle medicine and health and wellness coaches. So not only does that address the shortage of providers that we're currently having, but also redefines how and when a patient receives their care.
Thank you so much for sharing that. And I'm excited to see not only just where the program goes, but lifestyle health as a whole. I'm excited to see what it, grows up to be. And I love that you said patient-centered care, because I think that's of utmost importance. I think a lot of the time it can feel kind of like a conveyor belt. You spend your 5-10 minutes, whatever, with your doctor, and they just give you whatever they give to everybody else. And
sure,
being patient-centered is so important because we're so very different, all of us. So
definitely,
that's exciting to hear. I'm really excited for your program.
Yeah, that's where just to kind of comment on what you just said, that's where health and wellness coaches come into play. They are all about the patient. It's all about the patient's vision, their goals that they set for themselves. And so while lifestyle medicine is what drives that, we really need somebody to kind of put it into action, and that's how the coaches come into play. So yeah, some great future possibilities for sure.
Absolutely. And you're on the forefront. So congratulations.
Thank you. We're excited to be. We are definitely excited to be.
Good. Well, I do want to make an all call right now. If anybody has questions, comments, anything you'd like to say, please use that chat function. We did have a couple of questions sent in prior to today's event, so I do want to address those. Okay. So the first question that was sent in, it says, do you admit part-time students? So for example, students who take one class per semester, maybe they finish in 2 years.
Sure. So unfortunately, right now, we're only accepting students into a cohort, but we have definitely discussed this possibility. We really wanted to wait to make any changes until we had that first year under our belt. So definitely in our thoughts.
Okay, good. We'll stay updated though.
Send
me all those updates and we'll get them out to the people who
I will. Definitely.
Okay, awesome. The next question says, what is your advice on how we can utilize lifestyle health practices for juggling general life with all of the current stress factors that we have, such as the pandemic, election, news, and other life stressors?
Speaking of election, still not, yeah. So there's a lot that goes into play, but some general things. First is really acknowledging the stress. When is it happening? Why is it happening? What's the root of that stress? And then identifying how it affects your life. And then why do you want to make some changes? What would benefit from you making changes in this area? The second would be to implement interventions that are daily and consistent to help manage the stress. It's really all about creating a routine. In fact, all of lifestyle medicine is really about creating a routine of practices that are consistent and become a habit. So one kind of intervention that I would suggest for stress is mindfulness. Mindfulness is really the ability to be fully present and aware of where we are, what we're doing, but not being overly reactive or overwhelmed by what's going on around us. And so that would be a key to managing some of the stress. Exercise, of course, I could go on and on about that, but I won't right now. Meditation is also very important for managing stress. There's also some other techniques like learning cognitive behavioral skills that this focuses on identifying those negative thoughts and evaluations that go through our head and modifying those thoughts to help improve our mood and make better choices.
I think those are all helpful, especially, implement and stick to it. I think that is that's the hardest part, myself included.
Everyone.
It's easy to start a routine, but trying to do it every day and stay consistent is the hardest thing. So
sure, even if you don't completely complete whatever it is that you're wanting, just start it, and then eventually it will become a habit.
That's great advice. So I have one last question. Again, one more. I'll call to anybody. If you do have a question, put it in the chat. There's still time. The last question said, do you have any resources that you would recommend or tools that a person can try to incorporate lifestyle health into their everyday life?
Sure. So the resource I would give to anyone is really from the American College of Lifestyle Medicine. You can just go on the web and Google them. They have a resource page. They actually have a bundle of resources you can purchase, but they do have a books page where you can purchase each book separately depending on which area of lifestyle medicine you're looking for information on. So if you want more about sleep or stress, they have some different books about that. But some of my favorites, the one that I read a couple of years ago, which I really liked, and I think it's a broad book for lifestyle medicine, is Undo It by Dean Ornish. That would be my first go-to. And then of course I have to add my exercises medicine book into that resource list, and this is by Eddie Phillips. So those would be my two favorites.
Okay, great. Well, I can't wait to go to the bookstore down the street to go get some books, because I'm feeling very inspired.
I'm so glad.
Well, Dr. Zablosky, it's been a pleasure speaking with you. I'm so excited for the future of your program and lifestyle health in general, and I just I can't wait to see where things go. So thanks so much for spending your time with us today.
Thank you for having me. I really appreciate it.
And to everybody who's watching the recorded session, if you do have questions, comments, concerns, send them my way and we'll get them to the correct people. Otherwise, this session will be sent out and posted to our YouTube page. So feel free to come back and use this as a resource anytime. Other than that, everybody have a great stress-free Wednesday, and we'll see you next time. Thanks so much.
Thank you.
Bye-bye.